Okay, I am in video. Thank you. Thank you. Yeah, so many people came.
Thank you. Thank you, Bharti. We have other session. We have session.
Training because of serving lunch. Do you usually post this recording? Recording won't post, but if you are in our chef group or welcome to my kitchen, today this I will post in the Facebook of our Get Set Up also. I am a bit lazy, so always I don't put it, but today I definitely will post with the recipe. Get Set
Okay.
Up group is there, no?
Bye. Bye. We have other class at 4 o'clock. We have to join.
Okay, thank you, Shailaja. Bye. Excellent. All the 3-4 items I did not know. It's all new. Yes. I always find very simple but healthy dishes of our side or for Karnataka side. North Indian dishes आप लोगों को बहुत लोगों को मालूम है तो मैं नहीं भी करती हूँ. So if you want I can इसमें थोड़ा change करके South Indian style उसमें add करके I can show. No, I want to learn South Indian style only actually from you. Yeah. Then I will show South Indian. Many are there. I want to open one YouTube channel. Then you can. I don't know how to put videos, उसको trim करना है, उसको voice over देना है, and I am hoping somebody will.
Good evening, ma'am. Ma'am, no sound. You are muted.
Yes, I'm doing it.
Namaste, ma'am.
Lakshmi madam, you just mute yourself. You are listening to some another YouTube video also, something TV channel is going on. We are listening to that. That's why I muted you. Okay, keep yourself on mute.
Good afternoon, ma'am.
Good afternoon and welcome. Welcome. So today,
Good afternoon, ma'am.
Good afternoon. Good afternoon. So Nirupama Sharma, you weren't there yesterday. Roshan Jinwala were not there yesterday. KGY Raman not there yesterday. So we'll quickly revise about the hip pain also. Any quick questions? Vispi Dalal, newcomer, welcome. Hello, Carol.
I was here yesterday
Yes,
at 3 o'clock.
you were there.
Of
so
course,
you
I
were
missed
part
your
one.
9 o'clock program today.
Okay. Okay, come. We'll start the class because today we need to take a lot. We need to consider taking the knee also, the anatomy of the knee also. Okay. Mangalam, were you there yesterday or newcomer today?
No, I wasn't there, ma'am. Sorry.
You weren't there. Okay, so quickly we'll take a brief about what we did yesterday.
Yeah, thank you.
Yes. Vispi Dalal also wasn't there yesterday. Hello, Anita ma'am.
Hello, Dr. Vidya.
Hello. Smiling Shivani also was not there yesterday. Pravina Shah also wasn't yesterday. She was absent.
Hello, doctor.
Hello, hello. Hi, Antoinette.
Hi.
We'll get started. So welcome everybody to this nice class. It's a Wednesday bright evening, November, still hot in our Mumbai. And it's a class on understanding ankle, knee and hip pain. So this again to the newcomers is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. Okay. This is not only to your body, not only to the medical camp. Regarding anything, knowledge is actually power. Information is ammunition. You're well equipped if you're informed about the subject. And awareness is enlightenment. Only if you have awareness, you can be taking action. Okay, so that's why we call it awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize those symptoms, and then how to go about getting the right kind of treatment. By this, what I mean is that if we learn about our ailment, okay, if we learn about our disease, then we can learn to pick it up in the initial stages, and we can learn to nip it in the bud stage. What's the nip it in the bud stage? In school we had learned, no, a stitch in time saves nine. So something similar to that, we can nip it in the bud stage, and it cannot become a big last stage of the disease. It cannot become like a snowball effect. You know what is a snowball effect, no? When the snow, there's a small ball, if it goes on rolling in the snow, it becomes like a huge ball. Similarly, our disease also can become very big, and it can become fourth stage of the disease where the doctor tells you you come too late. So these camps are just for your awareness so that you pick up your diseases quickly and run to the doctor. I do not want any of you all to be saying that we have attended these camps since the past 3.5 years, and now I'm well equipped, I can manage my disease. No, a doctor is a doctor. Pay him for that. And quickly, these camps are just for your awareness to pick up your diseases in the initial stages. Leave the part of treatment, management, everything to the doctor. So yesterday, come on, quickly tell me this exam, what is the meaning of this line? Strengthening of the muscles around the ankles, knees and hip region help the muscles to have a firm grip around the bone, thereby preventing risk of injury and fractures too. Quickly tell me the meaning. I explained this meaning to you all. Hello, Seema madam. Hi, Dipali Shirke. What is the meaning of this line? Jaldi jaldi bolo, then we move ahead. Hema madam, bolo. Meaning हो गया, tell me. नहीं मालूम उनके लिए, न्यू कमर्स के लिए, आई एम सेइंग व्हाट इज द मीनिंग ऑफ दिस लाइन?
Just taking calcium won't do. We have to do exercises to strengthen the muscles.
Yes. So what is the example which we give for the exercises, Nisha Ratish?
Child is hugging her grandparents.
Yes, Antoinette. So let us make it a little filmy and little dramatic so that the newcomers understand it. They will not understand it like that, simple. So when you meet your grandchild after a very long time, okay, very long time after COVID, and meeting your grandchild, so how do you hug? Is it a very superficial hug or it's a very tight hug? It's a very tight hug.
It's a
No?
tight hug, yeah.
So when the grandmother is the bone, okay, grandmother or grandfather, whatever, that is the bone, and the muscles are the children, the grandchildren. If your muscles are tightly hugging your bone, this is the bone, the grandmother, and if the muscles are tightly hugging the bone, then even if you fall, you will not get a fracture, because these set of muscles are going to form a buffer around your bone. And this is exactly what strength training does. Your dumbbells, your exercises, not too much of yoga, but all these. That's the reason we tell you seniors have to be training for what? Hello, Needham madam. Seniors have to be training for strength training, where the muscle is going to the bone, which can prevent risk of injuries. Okay, a simple thing, you go to the washroom in the night, haven't we all heard? Old lady fell down in the bathroom and then she didn't recover, only she passed away. Very difficult to heal fractures, very difficult. Okay, that's why even if the muscles are strong and supporting, haven't you seen old people ka muscles hang like this? They have bat wings. So all that also can be reduced. I am not saying can be reversed. I don't want to sound like a magician who tells you this can be reversed, this can be reversed. Let's face the truth. Let's face facts. Clear? So the more you exercise, the more there is a grip of the muscles around the bone. Even in part 1, part 2, if you don't understand anything, if you just understand this one line, you're sorted. That I need to exercise my muscles, and no amount of calcium. Yes, we spoke, because the calcium which we take, the external calcium which we take, is always acidic. And to neutralize that, What is going away? The existing calcium which God has given you from birth in your bones. That calcium is being leached out to neutralize, and that existing calcium from birth is alkaline. To neutralize that calcium tablet, you're using this good calcium which is leaching out from the bones. And there's no way you can increase the bone density. There's no way you can reverse osteoporosis. You can halt osteoporosis. Okay, by doing exercises and gripping the bones, the bone density will also remain the same. Clear?
Yes, ma'am.
And this today we will learn about the hamstring. Then hips, tight hips lead to what? Why do you think we learned the hips are tight? Because the muscles, the hip flexors, the psoas muscle and all, they are overused. Because we use it for sitting, we use it for standing. A little baby also, when he's crying, he does Pavan Muktasan. That time also the hip flexors are very used a lot. That's why they become very tight. So this is the objective of today's class. And because of the tight hips, we have pelvic inflammatory disease. We have other complaints. This we understood is the hip bone. Okay, females have wider pelvises. This is your sacrum or your tailbone. And yesterday we learned that we do not know how to sit down. So how do we sit down? We just go and sit down on the chair on the fleshy part of our buttocks. But ideally, we should be pulling the right buttock on the right side, the left buttock on the left side. And when we pull the buttock flesh on either side, we sit on these two flat bones, which are known as the, tell me,
Teach.
Sits bone.
Teach.
Sits
SIT. Teach.
or the buttock balls or the sits bones. Okay. So these
Yeah.
are the, I'll show you all the sits bones that we call, go back. Yes. So if you sit properly, your pelvis would have a small anterior pelvic tilt, and this is the way we sit down. Okay. What happens when we sit on those sits bones? Balancing on your sit bones, it is actually spelled as SITZ. The doctor also tells you to take a sits bath in a tub of hot water when you suffer from fissures or hemorrhoids or piles. So balancing your sit bones helps to elongate the spine. Both the sides of our body. How can we understand? Because see, now I have also not pulled my buttock flesh, but there is more weight on my right buttock. So all of you all understand that what is this? Which side am I leaning more? Which side am I putting more of weight? Learn, understand and differentiate this. So when we pull the buttock flesh on the side, even if you're sitting on the chair, even if you're sitting in your car, or when you're lying sitting on the floor, you need to sit in this fashion. We are exposing the bursa sac and unnecessary, the ligaments do not have unnecessary pressure. Okay. Follow. Which kind of exercise did we do yesterday? Follow. Forgot exercise we did. Tell the newcomers.
Turning and
Contracting.
flexing of muscles.
Stiffening.
These
Stiffening.
are the exercises we did yesterday.
Yes.
Contraction of hip and
Yes. Yes.
Glut.
Very good. So how did we do them? Can anybody explain? Because they are lost. They don't understand, the newcomers. They've come for part 2.
Wherever we are sitting, whichever place,
Yes.
we can squeeze the buttocks muscle in, squeeze in,
Yes.
and then
Nice one. So can we just do it quickly so that the other newcomers also do it? So I am going to count 10. You're going to squeeze your buttocks very tight. Okay. Then we are going to count 10 and stay there with the tightened buttocks. And then we are going to release the buttocks to the count of 10. Now, you may be thinking, what the hell is she talking? But the buttocks are the least used muscles in the whole day for any activity. They are only used for sitting down.
Upward.
They're used only for sitting down. Hima madam, just mute yourself. Hima madam. Hima madam,
Yes.
just mute yourself. Anurag, where are you? Yeah.
Ma'am, I am the TA and I have muted.
Okay. Tina. Okay. मुझे मत म्यूट कर देना हाँ इंडिविजुअल जाके म्यूट करना so let's start doing the exercise. I wanted to tell you the benefit because we are sitting whole day the buttocks are not getting used and because of that we complain of a lot of back pain. People who sit for long hours in office also see why do you think they are so seated, why do you think they get a lot of back pain is because the buttock muscles have become loose. They have no work to do. So now we are giving them some work to do. And in that, if we contract, we are straightening our lumbar region also. See now when you do know, suppose you're contracting only the buttocks, you will be working on the hamstrings. That is the back thigh muscles. You will also be working on the back muscles. You will also be working on the side thigh muscles. Okay, let's try it. Come on. Squeeze. I'm counting 10. 1. Tighten and harder. 2. 3. 4, 5, 6, 7, 8, 9, 10. Squeeze very hard and stay there for 10 counts. 1, 2, 3, 4, 5, 6, 7. You can breathe. 8, 9, 10. Start releasing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and release. So this I taught you all yesterday quite slowly. We did 2 variations. I'm not going to take it again. This is just for the people who who were not there yesterday. You have to keep doing this exercise and you cannot say I don't have time for exercise. Did anybody come to know that I contracted my buttocks? Did I come to know you contracted your buttocks? No. Nobody comes to know. So you must do this exercise all the time. And then if you will not get back pain, you will never complain of other, even it helps the knees also. Why it helps the knees is because the back thigh muscles, they originate from the buttock, the smile of the buttock. So you are working on the back thigh or the hamstring muscles also. Okay, I will never ever give even my patients something, do this, do that. Why? You know why? You know why? Because it doesn't work. So yesterday I have this gentleman who gives me my grocery and my dry fruits from Vasai. He said, oh, I have knee pain. I'm going to come for your class. But you know what he said? At 2:45, no, Dr. Divya, give me a missed call. As a reminder, because I'm busy in my shop. You think I'll give the missed call? No, I remembered. I was in the kitchen. My family is leaving to go somewhere. I didn't, because if he's interested, he should come. Okay? Yes or no?
Yes.
The one who is interested will not forget 3 p.m. Yes, madam, tell me. Dipali, madam. Then he said, are you going to show exercises? I said, no, I'm not going to show exercises. I'm going to explain why it happens. You want to say something?
Yeah,
Go ahead.
I want to learn all these exercises because I am newcomer. I really want to learn because my back is paining and my knees are paining, ankle too paining. Ankle means my feet, upper feet.
So I don't disappoint you. I'm not going to teach exercises today. I am going to teach exercises on Friday morning at 9 o'clock. So this is a medical camp and yoga I take in the morning.
Yeah.
And I try to correlate the subject with the medical camp. Jitna hota hai. If not, then sometimes I give the schedule in a quick way. Then I cannot have the time of correlating things. But it is something to understand and then do. Because if you do it with understanding, you will do it for a longer period of time. Otherwise, you know, you'll just do it for some time and then you may leave it. So it should be very convincing to you. And when you learn through pictures, because we have visual memory, it registers. Okay, I'm exercising my hamstring. Okay, I'm exercising my this. Followed? That's why I take the pains of showing you slides. Because we learn through pictures. Otherwise, teaching you medical language is tough. But I'm sure at the end of the class, all of you all know what's a hamstring and what's a quadricep. That's my job to get it through. Okay, so this is the way we studied yesterday. And hips we studied again. We also studied something known as referred pain. Okay, so this is, it must be very small on your phones. So there is something which is known as referred pain. What does that mean? The pain can sometimes be caused by diseases and conditions in other areas of the body, such as your lower back can again give you hip pain, your knees can again give you hip pain, or tight hips can give you knee pain, or tight hips can give you back pain. So this type of pain is known as referred pain, and most hip pain can be controlled with self-care at home. Okay? Yeah, and
Self-care. What is that?
self-care. Yes, self-care. So that also comes with awareness. So what causes thigh pain is sometimes you may be injured, blood clot, then the tendon. Okay, tendons are the muscles are converted into tendons, and then tendons go and attach to the bone. So those can be inflamed. They are usually white in color. Quadricep tendonitis. Then IT band. This is usually tied in marathoners. The people who run a lot know their IT band. That is the ilio-tibia. Tibia is the lower below the knee, the bone. There's a band kind of thing that gets tightened in runners. So there are exercises to release that also. Or it can be some injury, trauma. And finally, it can be having a pinched spinal nerve. So from where the spinal nerves are originating, maybe there is a disc prolapse, or maybe there is a small tear where the labyrinth is coming out and it is pinching a respective nerve, and that nerve, whichever area it supplies, that gets pain. Okay, so don't think that if it is just hip pain or thigh pain, we have to work on which area the nerves are originating from the spinal cord. This is the healthy hip joint, and this is osteoarthritis. What did we explain about osteoarthritis yesterday? Come on, let me see who remembers. Osteoarthritis also we spoke something, no?
We said everybody will have,
Yes.
but not everyone will suffer from that,
Yes. Very
the
good.
pain.
Very good. So osteoarthritis will come to everybody. Okay. It's a sign of aging. It's a sign of wear and tear of your muscles. Sabko aega without fail. How much ever you take care. Okay. But if you take good care, in the sense, it will come, but it will not give you any suffering. So you only compare in your family. Okay. Your age, maybe your cousins or your sisters or your whoever, are they of the same health like you?
No.
No. And some younger ones also have diabetes. Some younger ones are very obese. Okay. So seeing all this, you must not say, "Arey, they are not." You must take more care of yourself. We can't change anybody. We can't. But through ourselves, we can be a moral example of a change. And never ever given to the people, if they are not taking care, why the hell should I take care? That's a wrong excuse. Because everybody has to manage their bodies themselves. And if you tell me, no, my family does not give me any support, that's the worst answer. I remember attending a workshop of diabetes, and that gentleman was saying he was a Keralite. It's worth listening. He was a Keralite living in Dubai. He said, I attended this diabetes reversal program, and there I am asked to quit the morning tea and take green smoothie in the morning or green juice in the morning. Now it's not so convenient like us. I remember when my husband will be going to his client, so he says, Divya, one papaya is 1,500 rupees. So I eat 2 slices of papaya, like, so they are spending so much, and they live in Marina Bay area, so it's very expensive. Like, here we get papaya for 50, 60, whatever, good ones, long ones. So you can imagine the greens in Dubai will not be like, hey, bhaiya, phone karke palak deke jana. Not like that, 20-30 rupees ka. Okay. So he said, I used to have green smoothie, and the first thing my wife told me, look, I'm not going to do all this for you. The wife said that. And believe me, the man used to make it on himself. He did it for 2 weeks. He did it for 2 weeks on his own, and his wife said, okay, I'll support you. Right? So you can be convincing your family members also, but very quietly, very silently. Not that you ask them to do it, but you do it for yourself. They will also change. You can set an example. Followed? You're smiling. It works. It works. But quietly, do it yourself. Wife also, and believe me, the wife will also drink the green smoothie then, because it is such a good thing. It is such a good thing to replace that morning tea. What say, Carol? Am I speaking sense?
Yes.
She's awake. So Carol is our friend. She wakes up 4:30. She's not from India. Okay. So this is arthritis bone. It's like a kernel of a coconut, tender coconut. Okay. It's becomes jabbed like this and jagged and rough, I could say. So it's that is in osteoarthritis, and this is a healthy hip joint. Okay, this is a normal healthy hip joint, and this is the arthritic hip joint with worn out cartilage. Obviously, if the cartilage is worn out, you will be having pain. And what is going to happen if the cartilage is worn out? Why will you have pain? Is because the bone is going to be rubbing against the bone. That's why you complain of pain. Okay? And cartilage cannot be regenerated, cannot be bought from Amazon or somewhere. Yesterday we ended hip pain, pain in the deep pain in the front or the side of the hip. Pain can be referring down the leg, can be even sciatica. Difficulty with daily activities, pain walking, worse if fast, further or on hard or uneven surfaces. So it's a good idea to be walking on cement, concrete roads rather than pebbled floors. And if one side of the muscle is short and the other side is of the normal side, the person may limp. And sitting up positions can be painful because I told you the hip flexors are working, and it can be morning stiffness or night stiffness. Okay, now what is this? Yeah, this is the site of inflammation. This is your knee, and this is I remember I told you the IT band. See, this is a huge band. It is white in color because it is fibrous tissue. Muscles, gluteus is the buttock muscles, which we just now tightened. There are 3 sets of gluteal muscles, and do not think that, where is that sir who came yesterday? He was showing my do 3 exercises. I think he hasn't turned up today. I don't remember his name. So these exercises, just do not take them with a pinch of salt. Mind you, do these exercises whenever you remember. I'm not saying 3 times a day, 4 times a day. Whenever you remember, tighten your glutes, stay there and release. It will also help you in your urinary problems, because by default, we are doing a Kegels exercise, right? We are contracting the anus. We are contracting our urethra also, right? So it's going to work on the pelvic floor. Pelvic floor is that hammock kind of area moving from your genitals to your anus. That is known as the pelvic floor. It strengthens the pelvic floor. Many ladies after deliveries have weak pelvic floors. After normal deliveries, they have weak pelvic floors because the child of the head was always there, and it becomes weak. Not child of the head of the child. Okay, now, what do you think? How you should be walking? How should you be walking? You should be walking small steps, or you should be walking big steps. Should you be walking on the treadmill? Is it good for you or not? Nobody? Big steps or small steps?
Small steps.
Yes.
Small.
Should we be using the treadmill?
No.
No.
Reason है मालूम? No?
नहीं,
Let me know it back for us.
Only small steps.
Yes. So what happens is that in the treadmill, it moves so fast that before you're done with the front leg, you are compelled to move and lift up the back leg also. Okay. So effects of long strides in walking and running is that there is increased extension of the trailing hip. Trailing means the one which is going to go forward, and increased load on the front hip. Okay, so if this is the stride length is big, so you should not be taking big strides. Again, another thing which happens is increased extension of leading knee, that is knee straighter. When the knee becomes straight, there is decreased shock absorption. What is this meaning? Is that in the knee, there is something known as menisci. You must have heard this person has had lateral meniscal tear. So what are the menisci? They are the shock absorbers. So you don't even know how much they are working, but they will work really a lot. And when suppose you are landing with a thud, when the floor is uneven, these menisci work as shock absorbers. But when we are taking very big strides, the knee is getting straight, there's extension, that is increased the straightening of the extension of the knee, there is decreased absorption by the menisci, and that's why this increased force is transmitted to your hip and pelvis when you take very big strides. So did you ever imagine that just a remote idea of taking very big strides can be so harmful to your hips? So you have to just think, if I have knee pain, not only knees, I don't have to think only of the knees. I have to think of other areas also. The surrounding areas I have to think. If I'm having hip pain, I have to think of the surrounding areas. Okay? Stride length should not be too much. Heavy heels strike well in front of, see this. When you're doing big strides, you're putting a lot of weight on your heel also. Okay? That's not a good idea. Three steps to reduce hip pain while walking as well as running. So the first step is to shorten your stride and walk and run quietly. More flats, less hills. What's the meaning of this? More flats, less hills.
More on normal surface,
Flat,
not climbing.
surface, more on the flat surface and less on the climbing.
yes, you should
Shoes.
be using inclined this thing, surfaces. Okay, good idea to be walking on flat surfaces. Now, very important to understand this. See, it's the same girl who was walking. What can you tell me about this slide?
She's bending
She's
backward.
pushing her abdomen in front so that she gets back pain.
So that she gets back pain, she's not aware. There are many times I stand like that. When I'm very tired, I stand like that.
Pelvic tilt is there.
Yes, pelvic tilt is there. And what is that thing on top telling you, that green arrow about gravity?
Center of gravity is not okay.
Yes, so tell the newcomers that there is a concept of COG. What is COG? Center of gravity.
Center of gravity.
Yes. And why is that significant? Is that you should, whenever you're standing, imagine this axis. Can you see? Can you see? Okay. So is this actual center of gravity passing through the center of a body?
No.
No, no.
And because this is bending forward, it's known as a sway hip. SWAY. So this posture must be correct. Now, don't you think you will remember this slide very well whenever you're standing like this? Huh? And when you tuck that tummy in and imagine like a rod, something is passing from the center of your head to in between your heels. Okay, then it's straight. When is the other way, then that this gravity, that this doesn't work well? Gravity, can anybody share? It's okay if we don't finish, then I'll take next knee pain next month also. But let us do things properly. Which is the other way commonly which happens when I lose my center of gravity while doing something?
Fall. Balance.
Lose your balance. Lose your balance and fall down.
Then,
Picking up things.
okay, what else? Picking up things after when I come back. It's just one action.
I think they're lifting.
Or that also, picking up things is lifting is same.
When we climb the stairs.
समझा कैसे अक्कल बढ़ जाती है क्लास अटेंड करने से? समझा? She said, we climb like this with the butt out and we climb. Do you think that's a good idea?
No, ma'am.
So you all may say when I'm not going to do it, but I believe me, stair climbing is the best exercise. And there are people who will tell you, but you know, doctor, I have knee pain, I can't climb the stairs. Then you know which answer I give them? Bolo senior students, what answer I give them? Dina,
You should climb. We should climb. It's a very good exercise.
करने का? Keep the
And some disturbance is there.
is there?
Keep the back straight while climbing.
Yes, but what I want to tell you is that stair climbing does not increase knee pain. Stair coming down causes knee pain. Followed? ध्यान से देखना कभी, ध्यान से देखना, मैंने तो बहुत ध्यान से देखा है.
Yes,
Yeah.
climbing down causes pain.
So it is supposed to be said coming down the stairs. We don't climb the stairs, we come down the stairs. Okay, so Nisha Ratish, what is the solution?
While coming down toes, you should see that toes should first touch.
It's a good idea to be climbing the stairs and coming down by the elevator. So if your building does not have an elevator, try doing it in a mall or somewhere. One answer, ma'am, please. Question in the end of the session. What is the question? Tell me. Where is the chat box? Yes, Hema madam, yes. But exercise is important. Calcium pills also have to be taken for some months and then left. You need to take a gap of calcium tablets. You should not take them completely. But if you're low in calcium, then definitely do your serum calcium test. It's cost just around 180 or 200 rupees. If you're low in calcium, take calcium for some time and reduce. And it's not a great idea to be taking calcium without vitamin D, because calcium absorption depends on vitamin D. If your vitamin D levels are low, calcium absorption nahi hoga. Okay, thank you for the digital hand thumbs up. So vitamin D and the calcium together. And vitamin D is oil soluble, so you need to be taking your good ghee or whatever fats, and then only it will be soluble. It is oil soluble, whereas the others are water soluble. Okay, so this is a good idea to be checking whenever you're standing in some queue. How do you think I'm standing? Is my weight proper on my both the heels? In the morning classes I explained how to stand on the triangle of the foot. See, my senior students are doing that, they know. Okay, so you must come for the morning yoga classes also. Otherwise, what happens? Haven't you seen in the kachre ka dabba, bata ka do patti ka blue color ka chappal, the toe is blue and the person has thrown it away because he has to buy new chappal, because full body weight he's putting on that toe. But if you're standing properly, understanding, am I sitting on my buttocks, both my buttocks, That's why if you're standing, you're paying attention. Am I standing and putting both my weight on my both my soles of the feet? Then only with that awareness you will be able to correct your body posture and evade a few diseases. Clear? So this is, I told you, sway posture. Why it may affect your back pain, how can you correct is just by awareness. But this can also lead to a lot of hip pain. So what to know about, what is this? Sorry. So, okay. What to know about hip dislocation? So commonly caused by car collisions and sports injuries. Okay, dislocate, hip gets dislocated also. It comes out from the joint. Involves damage to the cartilage holding the ball. This is also a ball. Yes, that sir was telling me, no, why not to do hip knee rotations yesterday. So holding this is a ball and a socket joint. Another ball and a socket joint is your shoulder. Very high risk of developing arthritis of the following injury of the joint following injury. Higher risk for needing a hip replacement later. Often entails hip replacement surgery later on in life. Okay, so how do you think you should be strengthening the hips? Okay, what is this posture called?
Butterfly.
Butterfly. Okay, but butterfly also should not be done just very, very shallow. You must take your legs up and open how the way I teach you. Open down, 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 down. What is going to go down? The knees have to be going down towards the floor. Okay, and this is known as opening the book exercise. What is she opening the book as?
Feet.
Feet. Her soles of the feet, she is opening at the mid place, top, and as at the heel also. She's opening the feet like a book. And what is going to happen when she's opening the feet like a book? The knees are going to go down towards the floor. What is going to be happening when the knees go towards the floor? Think and tell me. What is this exercise for?
Reduce the inner thighs.
No, no, no. It's not for reducing the exercise.
For the pelvic bones.
It's for the pelvic bones and
Hip flexion. Hip flexion.
chin. But the main aim of this exercise is creating space in your pelvic area. Now, the common example which I give you is 10 boys fight, no, little boys fight. Girls are much better. I'm very happy to not have a son. Okay, I have two princesses. So 10 boys in a small room. What do you think they are going to do?
Fight.
10
Fight.
boys in 10 separate rooms.
They will keep quiet.
Yes. So if your pelvic girdle has less space, what are the organs in your pelvic girdle?
Your uterus, your
Uterus,
bladder,
ovaries, bladders.
uh,
And do you know pelvis
end
is
of
so,
large intestine.
this is so much? But if there is compression, there is less space. Do you think they will do their functioning well? They'll not bang into each other. Pony nahi lagegi. Okay. So when you have done your Badrasan, especially the Supta Baddha Konasana, which Radha ma'am, do you remember in the morning class I have taught you with the belt? Wear the belt like this, get it on your tailbone, and Karnagar, do you remember?
Yes, ma'am.
The Konasana. So that belt, that atom bomb belt, is going to open your hips wider.
Yeah.
And see, madam, what is there in the chat? No, 1 second. Chat. Everybody chat. You should be family living. Huh? What? At 10, I don't mind coming at 10. Get set up that option. Then I'll come at 10 for exercise. Get set up wants me to come at 7 and 8 I am busy. 9 is also early for me. Okay, you give the suggestions. I don't mind. 10 is okay with me. But you know what? Seniors say that it's better to have it early than they can have breakfast.
Yes.
They have
Correct.
breakfast and then they can't exercise. So I'm telling you, each house has their own doorbells and everything. Every house is different. But every house in the morning is like Tiska Chopra in that movie, Tare Zami Pe. Have you seen how she leaves the sun making omelette, dupatta, this, running, and the boy is sleeping on the pot. And she wakes him up, "Arey, school bus aa jayega, school bus aa jayega." Every morning, every house is like that. I always remember Tiska Chopra. And the husband is sitting and reading the newspaper. Common story. So followed this, why hip Baddha is so important, and Supta one is because we can't be sitting for a longer time. In lying down or Supta, we can be really lying down well and opening our hip area. Okay. So the ones who are not understanding, I teach you in the morning on Tuesday and Friday class. We have different topics, but that comes under restorative yoga, which I take. And it goes as a slow class. We teach around 4 to 5 yoga poses in a day, in an hour. And this one is important is Supta Baddha Konasana. Then this is something which is known as a happy baby pose. Why happy baby pose? What is she doing? Because babies usually can suck the toe. Have you seen? They're so flexible, they can suck their toe.
Yes, ma'am.
Okay, so this is it. The pose also in lying down, and you move right to left. This also leads to what? Opening up of your hip curve.
Pelvic areas.
What?
Pelvic areas.
Pelvic areas. And this is again a twisting is required. Okay, a twisting. Now this is the Ardha Matsyendrasana. Sorry, this is the Ardha Matsyendrasana, and this is the Marjaryasan, which is a cat and a cow pose.
Cat and cow pose.
Yes. Now, what is important in doing this? You can be doing this for ages and ages and not have relief from hip pain. What is it that you need to do very importantly in this pose?
The spine will get erect.
Yes, but suppose the spine is only painful.
The
Spine
hip,
erect or straight?
hips,
It's what?
hips get strained.
Hips get strained? No, it means that you should use the hips for use. See this exercise, look at it, okay? Look at this exercise and tell me how I can be. It is for back pain, right? It is for back pain. So if I'm doing a cat and a cow, what should I be using? What should I be using? Yes, Fatima madam. You have raised your hand. Is it by mistake? Fatima madam, आपने ऐसे हाथ दिखाया है. Is it by mistake?
We can use small support for the knees.
Okay, that's one option. What else?
What's the question, ma'am?
I am saying what is the right way of doing the cat and the cow?
Kneeling down on the bed.
Still, what's the right way of doing it?
We will also do by help of a chair.
Okay, but this position on your force. You are on your force. How should you be doing?
With our breath,
Okay.
right breathing and all.
Gravity pulls.
So, what do you use when you're doing this? Let me ask.
Breathing.
Right.
What goes up and down in cat and cow?
Stomach.
The core.
Core and the stomach goes up and down?
Yes.
Okay. That doesn't work.
neck also.
Hip,
Neck.
hip,
Back, ma'am. The
hip,
back,
madam. Hip,
Ma'am, hip,
the
hip,
back region.
hip and neck.
goes up and down.
hip
Hip and
and neck.
I think I
neck
want my family to see how excited you all are to answer the quiz.
Hip and neck.
Spine, spinal area.
Spine,
back
hip
goes
and
up
neck.
and
So it's a good idea. Let me explain to you that have you seen the hinge of the door? What is the hinge of a door? From where the door opens, no? Towel below knees. Okay, that was answer given by others also. But you must use the hips as a hinge joint. That means when you do inhale up, use the hips. Okay, so for me, it works when I do inhale up, the hips separate and they are loose. When I do the exhale, chin to the notch like this, I contract my buttocks. Both go together. And again, when I do an inhale up, the buttocks are released. And when I do this, the buttocks are tightened. So nobody is going to tell you this. They'll just tell you karo. But when you use the buttocks to do Marjari Arsan, all the weight on your back is lifted off. It's lifted off. You're not using the back for Marjari Asana. You're using the hips to push your body up like a lever or a hinge, and you're pushing it down also.
Ma'am, how many times shall we do this?
Karuna Kar, your knees start paining. So you don't do even more than a 5. It's okay.
Yeah,
I never give you some. Many people ask me how many times.
I do 5 times.
My answer is always as per your capacity.
Yes,
So you do
thank
how
you.
many times?
5 times.
So next time, suppose you are able to do 10. Will you stop yourself? No.
No, ma'am.
I've told you, some days are good, some days are bad. The body
Bad.
behaves in a very erratic manner.
Yes.
कोई दिन आप 20 करोगे, कोई दिन नहीं चलती. बोलते no, break. Okay?
Yes,
I told
ma'am.
you, 10 days I have not exercised at all because we were not allowed to. We were only allowed to walk. So today in my evening class, I'm going to have a bad time because first week of where I go for my training, first week of the class is standing asanas. Second weeks are backward bends. Third weeks are forward bends. Last week is pranayam. जो people come like mad. सोने का class है, सोने का class है. Like these pranayams, we have different pranayams. So I know
Yes,
I'm
ma'am.
going to have a tough time. So sometimes you can do it. Sometimes it does not suit you. You have to respect your body and not do that day. You can't be fighting with your body. That's the only one thing which you have. I think we'll take knee next month only. Okay, and this. Why do you think Viprit Karni helps? This I explained to you all very well. Okay, so she's going to do it with the butt. Why do you think Viprit Karni helps? Legs up the wall pose is Viprit Karni. This is Viprit Karni. Okay, this one. This part, the left hand side. Why do you think it works? Legs up the wall.
Blood flows down.
Yes. So this Viprit Karni anybody can do. Even if you have had a cardiac surgery, no? Say after your 40 days or whatever you can do because the heart it's resting for the heart. Why do you think it's a restful action for the heart? Because now see I'm sitting, so my heart has to pump so much blood to the feet, to my hands, to my head also. Okay. But then I'm lying down and my feet are up the wall. My heart has to pump only from my shoulders to my hips. Only to my torso, my heart has to pump. So that becomes a relaxation for my heart. This much. Okay, only this much it works. Why I'm saying we'll take knee because I want to explain. I told you all in the yesterday morning's class also about the backward walking. So you have to understand. Today also when we went for the walk, those two ladies were again walking. And my husband, I was telling him what are antagonistic muscles and this and that and how you must. So that has to be explained very detailed to you all for you all to follow and for you all to implement it. Sometimes it's very pleasing to the ears and we don't implement anything from the class. That's not a good idea. You should be so convinced with even one point in the class and learn to implement it. Then it is 1 hour of time worth. Okay, so hip pain can be hip joint groin, can be sciatica. Sciatica is the nerve, sciatic nerve, which comes and originates from the lower lumbar region, goes down, and the pain can be shooting down to the heel also. Or they can be trochanter bursitis in the outside part of the hip. It can be inside in the groin. What's the groin? Do you know what's the groin? Groin area?
Yes.
In between your legs.
Between the
It's not
inner thigh and your pubic area.
Top portion of the inner thighs.
Good. So how I explain to my yoga students is that little boys, when you give them Barbies, do you think they play with Barbies? No, they want to detach the leg and they want to detach the hand. Okay. So when you get your foot off, the leg off, I remember Jayashree Ghosh gives this answer. She remembers it. They're very senior students. They don't come now. So that area, your torso, okay, the pelvis, that is known as the groin area. Inner thighs are the soft thighs, fleshy area, but groin is something much higher. Okay, so this is the IT band, which I told you all. Yeah. Now, what is the idea of doing this? Okay. Karnagar, can you tell me what else can you do in between the feet to get more pressure?
If we hold the feet,
What did you all say?
if we hold the feet,
A yoga block. See, Carol has said some right answer. So in between the feet, if you put a yoga block and push, try to make powder out of that yoga block. What are you going to do? You are going to work on these inner thigh muscles.
inner thigh muscles.
Okay. And again, you're going to strengthen them. And what the hell is she doing? She is leaning forward. Again, why do you think leaning forward helps?
It stretches the muscles.
Yes, yes, very good, Karen. Also, this is known as a bridge pose.
Bridge pose.
Huh? How are you going to do the bridge pose also?
By
Just-
holding a block between the knees.
Okay, but what area? Will you just take your back up?
Where we pull the buttock in.
No, you will squeeze the buttocks and go up with the weight side with the strength of your buttocks and not the strength of your back. Remember one thing. There was one patient who came to me. Severe tailbone pain, tried all physiotherapy because I do yoga therapy. Online only I took it, and she had called for that pillow also, tailbone pillow. And once I just told her, show me the way your physiotherapist has taught you Shalabhasan. She was putting this up, the iliac bone up. I said, how do you think it's going to help you? And once when patient gets well, you should imagine, she sent me 1 kilo of cashew because she was, see, it takes time. It takes time, but even on an online platform, you can understand what the person is doing wrong. So there are many people who will tell you bridge pose, just do it. But in bridge pose also squeeze your buttocks, then take them up and see how your bridge pose becomes superior and refined. Samjha? So you're doing something for the back and you're using the painful part only. Don't use the painful part of the back. It's for back pain. But release the pressure on the back. So each asana has to be understood well. Then it's going to give you benefit. Bridge pose, likh diya as a patient consultation, it's not going to work. And patient does not know that the person is doing Wrong. Patient does not know. Patient, for the patient, doctor is God. उसने लिख के दिया. You have to sit and explain. Charge the patient, but give them that proper time so that they understand. And then they'll tell you, she gave me that time. And she saw what I do, which asana I can do, which asana I cannot. So I think more than monetary part, that the blessings count a lot. Hello, Harsha. Clear? So this was it.
Yes,
Yeah.
ma'am.
And yes. This I will definitely put me in the next month only as a separate chapter. Yes. What Mini Gogia were you saying? Mini Gogia, you were saying something. I think it was you who said, ma'am. Okay.
I did not say anything, ma'am. Must be somebody else.
Must be somebody else. Okay, never mind. We've already crossed 4 p.m. So what I'll do is I have a separate class. Part 1, part 2, me ka hi chalta rahega. Don't worry. I will put it up because I'm not given my schedule. In fact, I'm late this time. I usually give it at the, I don't like anybody asking me. So before that only I give it up. My Diwali also I give it before. Not later. Okay. So we meet on Friday morning. Please do attend. It's a class on knee pain exercises. Yoga for flexible knees. To the people who joined in from Dignity, learn how to download the application, GSU application, get set up India, and then you can join directly through the application as a live class. Exercises are definitely different from the normal exercises shown on YouTube, and I believe they are effective.
Yes, ma'am.
Okay.
I'll be missing your Friday class, ma'am.
Okay. So thank
Because
you.
Thank you, ma'am, for the lovely.
Attention. We meet on Friday morning at 9 a.m. Bye bye.
Thank you, ma'am.
Thank you, ma'am.
Excuse me, ma'am.
Yes.
Can you please
Thank you,
repeat
ma'am.
the link that you said that we have? Is it an app?
Is it? Yes, it's an app. You need to download from Play Store. Get Set Up app. Get Set Up India with that red arrow kind of
Yes.
thing. And then you go to classes, and then you can find the various classes. Then type on the search box. You can type the name of the guide. I'm Dr. Divya. So from there, I'm new. Recording also is available, but not all recordings are there. So learn to attend the class also. Sometimes if you're lucky, some recordings are posted. Recordings also are there only. So what you could do is ask Abhijit or somebody to get in touch with you. They help seniors if they are not able. See, I understand we are not very techno savvy. So it's okay. We can help you all out. Okay. Bye-bye. Thank you for the gift of your time, energy and attention on Friday morning.
Bye-bye, ma'am. Thank you.
Nice day, Anurag is
Thank
there.
you very much, ma'am.
Thank you, Anurag.
Thank you.
Thank you, ma'am.